Hi everyone, I'm Dr. John Kennedy. Welcome to MD-VOD, your health live and on demand, where each week we examine a medical challenge to help you better understand what the challenge is, who's at risk, the common symptoms, how to make a diagnosis, treatments and therapies, and whether insurance covers the costs. Today we're talking about stroke, also referred to as a cerebrovascular accident, or CVA, caused by a decreased blood supply to the brain and rapid loss of bodily functions. Stroke is the second leading cause of death worldwide and the fourth leading cause of death in the United States. Every 40 seconds, someone in the United States has a stroke. When a stroke occurs, the affected area of the brain can't function, often resulting in weakness in a hand, an arm, or a leg, or the inability to formulate speech. Sometimes strokes affect our vision, our coordination and ability to walk, and in some cases, strokes can be deadly. Later in the show, we'll be joined by neurosurgeon and stroke specialist, Dr. Jeffrey Thomas. But first, let's take a look at the anatomy of a stroke. Welcome back to MD-VOD, where today we're talking about stroke, the fourth leading cause of death in the United States. A stroke is caused by decreased blood flow to the brain and has two major causes. An ischemic stroke occurs when there's lack of blood flow to the brain and can be caused by a blocked blood vessel or a blood clot that often travels from the heart to the brain. The second cause is a hemorrhagic stroke, where there's a weakness in the blood vessel, like an aneurysm, or caused by severe high blood pressure. That's our anatomy lesson on stroke, so make sure to stay tuned and learn more with our neurosurgeon, Dr. Jeffrey Thomas. We're back on MD-VOD, where today we're talking about stroke, and we're joined by neurosurgeon and stroke expert, Dr. Jeffrey Thomas, who's joining us from Washington Hospital, where you're director in Fremont, California. Jeffrey, thanks for joining us.
It's my pleasure.
And we're just going to start right off. What is a stroke?
Well, a stroke is actually an interruption of brain activity that's either caused by lack of blood flow or by bleeding. So a stroke is kind of a broad term, but the common final pathway is you lose brain function.
Mm-hmm. And who are at risk for stroke?
Well, we are all at risk for stroke. I think one of the most important things to take away from this show is that the risk factors for stroke are very well known, and therefore they're modifiable. So high blood pressure, patients with high blood pressure are at the highest risk for stroke. Patients with diabetes, patients who smoke. Smoking is a huge stroke risk factor. So that's the description of the general population that is at risk for stroke. But within that set of risk factors, stroke also tends to break down along demographic and population lines. So if you're black, you have twice the risk of stroke as a Caucasian person. There are certain Asian populations that are at high risk for certain kind of stroke. And of course, within stroke, there's a difference between the hemorrhagic, as you mentioned, which is bleeding stroke, and ischemic stroke. And ischemic stroke tends to be a disease of older people. But hemorrhagic stroke happens to be a disease that affects very young people. And I have many patients who are in their 20s, 30s, and 40s with serious strokes.
Wow. So it's a disruption of blood flow, either bleeding with hemorrhagic stroke commonly affecting younger patients, and ischemic stroke, which affects elderly or older population of people. It's interesting. You're a neurosurgeon. I'm a cardiologist, and it's great hearing you say that even though we spend our lives inside the operating room, I'm in hearts, you're in brains. A lot of this is preventable. Can you tell us about what things you think that are risk factors that are really simple to treat that might change, the incidence of both diseases?
Yeah, this is really fascinating. What you say about how we are both surgeons doing something in an operating room and how we're both intently trying to prevent that situation for our patients, that's fascinating stuff. And the fact is that strokes and heart attacks have very much in common. Many of the risk factors, like high blood pressure, are exactly the same. The physiologic process that narrows a blood vessel and puts both your brain and your heart at risk is a very similar process, the process of atherosclerosis, which is heavily contributed to by things like smoking and high blood pressure. So there are your two most important modifiable risk factors right there. If you stop smoking, you will dramatically reduce your risk of heart attack and stroke both. And when I speak to my patients, they are always surprised that smoking, which you would think impacts the lungs more than anything else, actually impacts blood vessels very, very heavily. As far as high blood pressure is concerned, that's known to be the most serious stroke risk factor, and also very big risk factor for cardiac disease. So if you can control blood pressure, you are well on your way to being very healthy and being out of the reach of things like stroke and heart attack.
That's a great point, Dr. Thomas. So lowering your blood pressure, first of all, normal blood pressure, you want the top number less than 130 and the bottom number, which is the diastolic blood pressure, ideally less than 80. And stop smoking, because smoking, as Dr. Thomas points out, affects our blood vessels in our legs and our brain and our neck more than it affects actually our lungs. It's a great take-home point. You know, people come to you sort of in the throes of a stroke. Can you tell us a little bit about what are the most common symptoms of stroke and when you might see a patient?
Well, the first thing to realize is that there's a big distinction between these two types of stroke. So the hemorrhagic one that Dr. Kennedy mentioned is a bleeding stroke. That kind of stroke tends to affect younger patients, at least for ruptured cerebral aneurysms, and that is usually signaled by an enormous headache. So that's a stroke symptom that that informs you that your life is in danger. When you get an intense headache like that you've never had before, that's a reason to dial 911.
So good point, and I don't mean to interrupt, but the worst headache of your life, we often learn in medical school, is that's actually a truism.
That's the textbook description of a subarachnoid hemorrhage. There are other hemorrhagic strokes that you get when you're older, which is bleeding directly into the brain, and that is associated with high blood pressure that's been uncontrolled for many years, and that also will be signaled usually by a large headache. Now, the other kind of stroke, which is ischemic, this is a big trap, and the reason it's a trap is that it doesn't hurt at all. Most strokes of the ischemic type are absolutely painless, and that's a big deal, because pain is usually what makes us go to the emergency room and see a doctor. If you have a painless loss of neurological function, you're more prone to wonder what it's about and think that if you go take a nap for a time, you'll wake up again and it'll be okay. That is, nothing could be further from the truth, and that's the most dangerous thing that you could do. So to zero in on what the stroke symptom would be, it's a loss of neurological function or a headache.
That's a great way to make it simple. Strokes again, ischemic stroke, that means a blocked blood vessel either in our neck or in our brain, or a clot that can go from our heart to our brain to block blood flow. Ischemic strokes are subtle, as Dr. Thomas points out. We might lose the ability to speak, or the ability to enunciate, or to even understand. You might be nonsensical. That's where stroke sometimes can be subtle, and it's helpful to hear from family members. Because I can't tell you how many times I've made the diagnosis of stroke based on what the wife or the family members tell me, because it's so subtle. Once the diagnosis or at least once someone comes to you and you take a history, it sounds consistent with stroke, what are some of the diagnostic tests that we do to confirm that it's true that you had a stroke?
If it's an ischemic stroke, and if someone has just lost neurological function, then the most important diagnostic test to do is a neurological exam. So the doctor examines the patient and also gets the history, which is always going to be some kind of loss of neurological function, the clue to which is sidedness. So if something is not working on one side of your body, that's a huge red flag, and that is what the examiner or the doctor, one of the first things to determine. Now, if it's a hemorrhagic stroke, if you've bled somewhere in your brain, that's not subtle, and the most important diagnostic study to get then is a CT scan of the brain. You go to the emergency room and you say that I had the worst headache of my life a couple of minutes ago, you'll get a CT scan within the next 5-10 minutes at the most.
And this, just to kind of give you an idea of what Dr. Thomas does every day, worst headache of your life or trauma to the head, patients are flown to him at his hospital, Washington Hospital in Fremont, by helicopter. They come to the helipad, and within minutes, I would imagine, they're in the operating room, and you are decompressing the brain because there's bleeding or some trauma emergency.
Yeah, the important point about that is that stroke is time. So everything about stroke is about speed. In an ischemic stroke, there's literature out there that has quantified the number of neurons that are lost in 1 minute. It's almost 2 million neurons a minute that you're losing during this period of relative absence of pain. So it's a big deal. You're losing brain tissue at a phenomenal rate.
So,
yeah, go ahead. I was just going to say that the bleeding type of strokes usually, unfortunately, a lot of people with a ruptured aneurysm or that kind of bleeding stroke will die immediately. There's a mortality that's immediate of 20 to 30%. But if you get to somebody like me or a hospital center that's designed to treat this sort of thing, then the plan is to orchestrate surgery that's very sophisticated surgery in a short enough time frame so that you don't have any more bleeding. Usually if bleeding like that starts, it only goes on for a second or two, because if it goes on for more than a second, you die.
So that's great information. I want to thank Dr. Jeffrey Thomas. Make sure to stay tuned to learn more about how to prevent strokes from ever occurring, and join us next because we'll take your questions live on Facebook and Twitter. I want to thank Dr. Jeffrey Thomas, neurosurgeon, coming here from Fremont, California. Thanks so much.
Thank you.
So now, welcome back to our Apple a Day, where there's good news from the National Stroke Association, because up to 80% of strokes can be prevented. Here's a few tips. First, smoking doubles the risk of stroke. So if you smoke, you should work on kicking the habit. Also, many studies link stroke to alcohol use. So if you drink, be responsible. And obesity and excess weight puts a strain on the entire circulatory system and are associated with high cholesterol, high blood pressure, and diabetes, all of which can increase your risk for stroke. So healthy eating habits and regular physical activity can help reduce stroke. So start today and reduce your risk. If you have any concerns, remember to always talk openly with your medical professional and reach out to the cdc.gov for more information, because the more you know about the dangers of stroke, the better. I hope our show on stroke helped you understand the disease, how to prevent it, and what you should do if it strikes you or a loved one. This program and other episodes you might have missed are available on demand at emPOWERme.tv's website and our YouTube channel, where you can subscribe to us and sign up for the newsletter for updates on the show and the channel. Don't forget to like us on Facebook, follow us on Twitter, and share us with your friends and family. And be sure to leave us your comments and questions so that we can better help you. I'm Dr. John Kennedy, and you're watching MD-VOD, Your Health Live and On Demand, here on emPOWERme.tv. We'll see you next time. We're back on MD-VOD, where today we're talking about stroke, and we're joined by neurosurgeon and stroke expert, Dr. Jeffrey Thomas. And now we're taking your questions live from Facebook and Twitter. First question is, Dr. Thomas, when someone presents with, let's say, an ischemic stroke, and we talked about that a little bit earlier, the difference between ischemic and hemorrhagic. Let's say they have an ischemic stroke. It's they have loss of the right side of their body. What are some of the therapies available?
Well, that part of stroke is a medical emergency, and the most important thing to do is to restore blood flow to the part of the brain that's suffering and that's causing that neurological deficit. So there are two branches of treatment. One is medical, and the other is surgery. We usually try medical first, and in 1996 there was a drug that was FDA approved for stroke. It dissolves blood clots, which are often the cause of stroke, and that drug is TPA, tissue plasminogen activator. We will administer this drug to a patient with a new stroke if the stroke has occurred within the last 4.5 hours. It used to be 3 hours, but the studies have shown that it's actually safe enough within 4.5 hours. So once we determine that you have not had the hemorrhagic or bleeding type of stroke, then we consider it safe enough to give this drug.
So TPA, it's a very fancy blood clot dissolver. It has other names as well, but it's a time-dependent thing, so that's very important. Make sure if you have symptoms, a loss of hand control, losing the ability to speak, for example, your foot one-sided, as Dr. Thomas points out, get to the hospital as soon as possible. You may be a candidate for this new medication. When is surgery indicated? Let's say a carotid endarterectomy where they remove the plaque in the artery or put a stent in. Yes. When is that indicated?
Well, the type of surgeries that we have for stroke now have increased substantially from, say, 10 years ago. And the reason for that is the branch of medicine that is known as interventional neuroradiology, which is a way to operate on the brain from a remote location, usually from a tiny incision in the leg. So through the incision, an incision that is the size of an eyelash, a tiny catheter can be passed all the way from the leg, through the chest, through the neck, into the head, into the brain, and delivered to the segment of artery that's blocked. Once we get there, and this is exactly what you do in the heart, except we go further, and once we get to the area of blockage in the brain, we can deliver more of this drug, except now we deliver it directly to the site of occlusion, or we can use a surgical device to pull blood clot or debris out of the artery. And these devices are brand new. We're talking about FDA approval for some of these devices that just happened not more than 2 months ago. Wow. So now we have technology that allows us, these catheters and micro guide wires are phenomenal. This is not only digital imaging technology, but it's also micro machining and hydrophilic materials so that you can slip through the bloodstream undetected by the body. These are phenomenal new technologies available to create brain surgery for stroke.
Wow, that's amazing. Very similar to cardiology, but what's impressive about what you do is, you know, mine's easy because I have a wire that goes from your leg to your heart, which is a pretty short distance. You're going all the way up into the circle of Willis, and
it gets curvy up there.
It does get curvy up there, and so it's a lot easier than he's making it sound. You know, other than the TPA, the guide wires and stents and things, is there any new therapy in interventional neuroradiology that you can use for, let's say, aneurysms or even tumors in the brain that can cause strokes?
All of the above. In fact, these microcatheters and microguide wires will deliver you to whatever pathology exists in the brain. Now, aneurysms are like a balloon on a blood vessel, and the problem with those is they burst, usually without warning, and they put you in immediate danger of death. So the goal of aneurysm surgery is to prevent that bleeding from ever occurring again. With the tiny catheters, we can now guide things like platinum microcoils right into the aneurysm sac and deliver the microcoils in such a way that we just fill it with platinum, and it can no longer fill with blood. That's one of the more modern aneurysm treatments. Of course, we still have the old-fashioned 1937 aneurysm clipping with a titanium microclip that's opening the skull and getting right in there using an operating microscope. And so we still use that for 50% of the cases.
It's impressive stuff. You know, all of this technology, these hydrophilic guide wires and the aneurysm treatment that you're talking about with the coils, it's incredible technology. It's got to be expensive. What about insurance? Does insurance typically cover the costs of some of these new technologies?
Yes, and the reason that insurance will pretty unequivocally cover such costs is that these are life-threatening emergencies. Every case of a stroke or a ruptured cerebral aneurysm, that immediately puts you in danger of death, and the insurance companies would have a very hard time denying that kind of payment.
One of the things I wanted to mention about Dr. Thomas is, you know, he's a neurosurgeon. Literally spends his life saving lives of people that are flown in by helicopter, literally, and he is a neurosurgeon. You know, what's also really impressive, I have to say, personally, about you is that you spend a lot of your time talking about and teaching the community about prevention. Preventing strokes from ever occurring with kids and the San Francisco Stroke Shield Foundation. Can you tell us a little bit about that program?
Yeah, just as you say, we have tremendous technology these days, and it does wonderful things, but stroke and cerebrovascular disease are the perfect illustration of where an ounce of prevention is worth many pounds of cure. So what these diseases are all about is prevention, similar to your own specialty of cardiology. So, with that in mind, the Stroke Shield Foundation, which is strokeshieldfoundation.org on the web, it's an organization that is whose purpose is to implement improved treatment and prevention of stroke. If you think about what we already know about stroke, the fact that we have identified these risk factors, the risk factors are very strong, and every single risk factor is modifiable. That means we have control. The patient has control. So it's the job of the doctors and of organizations like Stroke Shield Foundation to make it so that people pay attention to these risk factors. You know what's out there, and heaven forbid you should ever know what a stroke is really like, because it's a life changer, it's a life ender, and if we can prevent it, we should do everything in our power. And prevention is a lot simpler than treatment.
And in the long run, saves, you know, I would imagine a lot of money in terms of healthcare dollars.
Absolutely.
That's a great point. I want to thank Dr. Jeffrey Thomas, the Director of Interventional Neuroradiology at Washington Hospital in Fremont, California. He taught us about the diagnosis, the treatment, and prevention of stroke. This was a great program. I want to thank you very much. If you missed anything on today's show, please go to emPOWERme.tv, MD-VOD for stroke. Thank you so much. We'll see you next time. Thanks, Dr.
Thanks.